Well, breast cancer can happen to anyone at any time. In today's Health Watch, Local 5's Caitlin Corbett shares the story of one woman who's reminding others to advocate for their health.
Korissa Diehl had stayed up to date on her mammograms, which always came back clear, but discovering a lump one day would change her life. Now she's advocating for other women to stay on top of their health.
I was laying in bed and I was just kind of moving around and I felt a lump. It was bigger than normal and it felt almost like a pulled muscle. So I was concerned, but not really. I was just like, this is different.
That's oftentimes how people react when they discover something off with their body. Korissa Diehl was no exception in thinking a lump high up on her breast was nothing serious. After all, her annual health exam was just a few days away. But at that appointment, things changed. Her primary doctor suggested a mammogram, which confirmed a mass, leading to an ultrasound and a biopsy. That confirmed the worst, stage 2 breast cancer.
I remember nodding my head and my partner was standing next to me, and I remember her lifting her head to the sky and looking down and tears. And after that, I was still on the phone, but I didn't hear anything what she was saying. I never in my life had a moment where time actually stopped. Time was non-existent.
Time would soon speed up. Diehl opted for an aggressive approach with a double mastectomy followed by reconstruction, but more cancer was discovered.
Based on the type of cancer that she had, we recommended chemotherapy first. All patients will then require surgery, and then some people may need radiation afterwards.
Diehl needed both, and when all was said and done, she was finally cancer-free. She opted for deep flap reconstruction, which uses tissue from elsewhere in the body to reconstruct the breasts without implants. Diehl is still adjusting to new norms within her body, but she's grateful to have the chance to do so.
I think that with my treatment now and the reconstruction, now it's just a matter of learning how to navigate my body all over again. It's different. I have a lot of scars. It looks different, but it's just a war zone, but it's a beautiful battle zone, I guess, if you will.
Diehl wants her story to be a tale of self-advocating and of caution, that we always have time for our health.
We are never too busy to give self-care and to take care of our health, and to make sure that, especially if you have dense breasts, to follow up and advocate for yourself. We want to have that care, that checkup, so we can continue living the very best life that we're given.
To learn more about breast cancer care at Aurora BayCare, visit their website. And that's your Health Watch. For Local 5 News, I'm Caitlin Corbett.
Thanks, Caitlin. Tomorrow on Health Watch, busting some common health myths.